which, there you go. And that means it will be posted on the COC's website, so you could view it later on or have your colleagues view it. If you could, it's a short meeting. It's intended for you to get as much information in a short amount of time as possible. So if you could remain muted, that would be awesome. You could put some questions in the chat. We may not be able to get to all of them today, but if we have time at the end, we will certainly open it up for questions. If you were forwarded the invite to this meeting and didn't receive it directly and would like to be invited to future meetings or receive any materials that are distributed or talked about today, then email me and I will pop my email stuff in the chat in just a moment. So thank you for joining us. Okay, let's go to the next slide. Okay, sorry, I'd added these slides and I forgot what I added. So this is a webinar series designed for staff who are working with Mendocino County community who are in need of housing resources. So this webinar series was not designed to speak directly to the client, but more to those the advocates and staff that are helping them navigate the complicated housing sessions or complicated housing issues. Each session is focusing on a specific sector of housing. So the last session focused on emergency shelter, and that session can be viewed on the COC website. Upcoming sessions are going to focus on transitional housing, subsidies and vouchers, and low-income housing. Okay, next slide. Okay, so we have a bunch of presenters today. We will have Paul Davis and Tabitha Connell from Mendocino Coast Hospitality Center, Shai Schnall from Mendocino County Youth Project, Jen Aragon from Redwood Community Services, myself, and Tammy is joining us, but to talk about Social Services Front Door for Families program. Each presenter is going to have 10 minutes to give us the basics about what their program provides specific to housing navigation. So each of these agencies provides a variety of services and resources and many other housing resources. But today we're just going to focus on their housing navigation programs. And we will get started with Paul and Tabitha from Mendocino Coast Hospitality Center. Hi, Paul. Thanks for joining.
Morning. Thanks for having me. Unfortunately, Tabitha couldn't be here this morning. But I've been here a while. I think I have all the information. So, yeah, the Hospitality Center is located at 101 North Franklin Street in Fort Bragg. We are one of the COC's front doors for coordinated entry, which is your first stop typically into our housing navigation services. We operate a wellness center and homeless resource center at that location, which people experiencing homelessness can visit 5 days a week from 8:30 to 12 and 1 p.m. to 3 p.m. So everyone is given a triage up front that helps identify your immediate needs, including your needs for housing navigation services. We have a lead housing navigator. Her name is Tabitha Connell. And in addition to having her own caseload for housing navigation, she is also the go-to person for our other providers. So we operate a lot of programs out of the Hospitality Center. We have people going to our vocational services programs. We have people going to utilizing our specialty mental health service. And so providers in those other programs will confer with our housing navigator, and she will provide them guidance and sort of oversee their case, and give those providers some of the legwork in helping these folks through the housing navigation process. We provide housing navigation through a number of different programs, sort of grouped together. So we typically have rapid rehousing available. We also do CalAIM community supports, which anyone can make a referral to. It's not guaranteed that we'll get that referral. There's other agencies who also provide that, but we get most of them on the coast. And I can send anybody information about how to make those referrals. It's really easy. There's a form and you email it. What folks get with the community support service is a little bit similar to rapid rehousing in that there is a once in a lifetime $5,000 housing deposits stipend that they will pay, and we coordinate that, so we help pay for that and get it reimbursed. Similar to rapid rehousing, which also will pay for some moving costs and rental assistance. So that's a really good program. Folks should take advantage of that if you're working with a client on the coast. It's a good idea to make that referral yourself, or we can always be contacted too. We can make the referral internally and get them hooked up with that. And our housing navigation services include helping folks budget, helping folks apply for resources that they may need, including income resources, vouchers if they're available. We help them get onto any housing waiting lists that there might be locally to low-income housing. We have relationships with landlords, local landlords, and housing projects, so we can really readily identify open units and help folks apply for those. We can be the go-between between them and CDC if there's, if we're working on vouchers. And then we also provide aftercare. So we will continue to work with folks after they get housed to help them stay housed. We are the resident services provider at the Plateau Housing Unit. So that gives us a really unique opportunity to both help folks get into that project and then be there on site throughout the week so that we can help them stay housed and overcome those barriers that sometimes folks have when they're newly housed and they've been on the street for a long time or in shelters for a long time. Yeah, so we kind of have a no wrong door policy within our agency. So housing navigators and other staff that work with the housing navigation person are they're close by and they're on site. So if you make your way into the hospitality center through the shelter, we're going to get you over to housing navigation that way, or we're going to visit over there. If you make your way to hospitality center through specialty mental health services, your care manager or your clinician are going to route you over there as part of our full service system. So yeah, I don't know if anybody had any questions or.
Let's hold off on questions until the end of the presentations, but we'll keep an eye on if there's questions in the chat. And if we have time at the end, we could go through those as well.
Great.
Yeah. Okay. Thank you, Paul. That was great to hear about your housing navigation program. Let's see, who do we have next?
We have Scott Marsh with
Okay.
Mendocino County Youth Project.
Youth Project.
I called and checked in, and we had a little bit of a change in presenters. Scott didn't know he was doing this until just a moment ago, so please be understanding and patient with him. Scott, this is a group of folks from various service providers who interact with people experiencing homelessness, but don't necessarily specialize in it. And they're looking on how to refer into the appropriate services. So we know that the Mendocino County Youth Project serves a lot of youth who are experiencing homelessness. So we were hoping that you could just give an overview of, what that looks like there.
Okay. Yeah, so we are the Mendocino County Youth Project. We are in our 50th year here in Mendocino County, which has changed over the 50 years quite a bit. We cater to the youth from kindergarten age to 25. We have a drop-in center. We have 2 shelter houses that are with 2 programs that are emergency shelter, 45-day program, and then an independent living shelter, which is kind of a 2-year program. And I'll talk more about that in just a second. We also have our drop-in center. The drop-in center is usually open during like the holidays and summertime. We're trying to staff it up to be open 1 day a week during school hours. We're just not staffed for that right now. So spring break, Christmas break, those kind of holidays, we try and be open for the youth to come in, do activities, stuff like that. We also have supervised visitation monitors. So we do that from the courts. What else? Services. And then we do have therapy services. And then our youth coaches, our YSP program is, we have youth coaches that are just there to help the kids get better and find resources and help find resources that they need. Going back to the shelters, we do have 2 shelter homes. They're for ages 18 to 25. Once they hit the age of 25, they have to be exited. But the emergency shelter program is 45 days. We bring them in when they're, on the streets. 45 days, help them find other resources and stuff like that. The independent living one is a 2-year program. We don't necessarily want them there for 2 years, but we give them 2 years to get on their feet. We try and help them find jobs, get them into schools, whatever kind of resources they need. We really want to help them become independent. It's not a 24-hour staff. It's not staffed 24 hours. So it is on them. There is requirements to stay in the home with chores. They have their chores that they have to do, that they're assigned to daily. They have to do 20 hours of productivity, which is a job, school, or volunteering for 20 hours a week. That is the main requirement. And then, like I said, chores, and there is a curfew, 10 o'clock during the week and 11 o'clock on the weekend, which is like Friday, Saturday, and then the weekdays run from Sunday to Thursday. It is co-ed, but we keep them separated in rooms. Males are in one room, females are in the other. We also accept families. They will have their own room, like a married couple with babies or children. are accepted. Right now we are full. We do have a waiting list. The waiting list isn't necessarily first come, first serve. It is kind of a priority on the situations. Oh, excuse me. Yeah, I think that's kind of the basics of it. Is there any other information, Veronica, that you think?
There was one thing that Amanda and I had spoken with in the past,
Mhm.
and it's that you guys are able to work with any families who have experienced domestic violence and
Mhm.
have someone in their household under the age of 25. Can you talk a little bit about what that looks like? If that's
Well,
still happening?
Yeah, I mean, I'm not quite versed on all of that. Like, so I don't know. Yeah, I don't know how much I could talk about that part of it right
Okay.
yet. We do help. I mean, we are not like Project Sanctuary. We're not that like that kind of service, but we do, you know, we do have DVs in the shelters.
Okay, excellent. And just as a real quick summary, I know that anytime someone's working with someone in the household that's 25 or under, between 5 and 25, you can do their online referral.
Oh, yes.
And that's available at their website, mcyp.org. And
Yes.
it's a really great way to get someone connected. And they will reach out and contact that person.
Yeah, and it's really it is really easy once you get online for the services. The one thing that we do ask when you put a referral in is put as much information down on the referral and the needs as possible, just so we have an idea of what support and where we can help out the most. Because we do have a variety of services that we can help with. The more information we know going into it, the better.
I just wanted to ask one quick follow-up question. So if we refer a client in who's struggling with their housing for
Mhm.
housing navigation, what can they expect that process to be? Do they get an appointment? What kind of, what's the plan for what kind of guidance they're given?
Yeah, so there's an appointment that'd be assigned to one of our caseworkers, meet up, and then it would be more of our support. Whoever they're assigned to would support them on going to where they need to go, or helping them online and stuff like that. Is that kind of answer? Yeah.
Okay,
Yeah.
thank you.
Yeah.
And we had one question in the chat, just real quick. They asked, where are you located? And I said that your head office is in Ukiah, but you do offer services in Fort Bragg and Willits as well, but maybe not.
Well, yeah, we serve all of Mendocino County.
Okay.
We don't. We have staff members in Fort Bragg. We can have staff members in Willits, Ukiah. We are in Potter Valley a little bit. Like, these are mainly the schools that we're at. Like, we're at the Potter Valley School, we're at the Fort Bragg schools. We're no longer in Willits or Laytonville schools, but we can still serve the youth from those towns. And then the outlying areas, we don't necessarily always like go to like Point Arena or those. We don't have staff going there, but they can come to us. Like, we can serve them in Ukiah, especially for the shelter needs. We are definitely mainly Mendocino County.
Great. Thank you, Scott. Thank you for being willing to jump in last minute as well.
Yeah, no problem. Sorry that I didn't know about this.
That's okay.
No problem. Thanks for showing up, Scott.
Yeah. Sorry, real quick though, is that like?
Yep.
Okay.
Yeah, stick around in case there's questions at the end. If you're
If you
able to
can.
stick around, that'd be great.
Okay. I'm not. I got to go to juvenile hall.
Okay.
Okay. But yeah, if you guys need anything, like do you have my email address?
I do, Scott. I know how to
Okay.
get hold of you. So I will, any questions that we have at the end, I will send to you via email and we'll distribute those to the group.
Okay, and just so you know now, like I just got promoted. I'm now the program manager here.
Oh, great.
And we do have a housing coordinator as well. So I can get you in touch with Dawn, our housing coordinator, too, if there's anything needed with that.
Beautiful. Thank you,
All
Scott.
right. All right. Have a great day.
You too.
Bye.
Okay, we got Jen with Redwood Community Services. Jen, you ready?
I am. Hi, I'm Jen
Wonderful.
Aragon. I'm with Redwood Community Services and Building Bridges. I see that it says Homeless Resource Center. So we have a Homeless Resource Center at Building Bridges. The service hours are Monday through Friday from 12 to 4. We have, and there folks could do laundry and showers, and there's a computer there. As for our housing navigation, we have a few different housing programs. We also do Cali Community Supports, housing navigation, and housing stabilization. They must be enrolled in partnership or have active partnership, Medi-Cal. To be referred, they can go to Building Bridges during service hours, 12 to 4, and request a referral for housing navigation. It's also a really good idea to make sure their screenings are updated. So if they haven't been screened for coordinated entry, it's a good time to do that there. Then they are assigned a housing navigator. We currently have 2 housing navigators with very full caseloads, but very soon we have 2 more housing navigators starting. So that'll give us some more room on our caseload. And community supports can pay first month's rent and security deposit. So we work with our folks to find another way to pay for housing, whether it's through work or through housing vouchers, which is probably a good time to plug in that the mainstream voucher pre-application waiting list is open at CDC and it's going to close on the 18th. So if anybody needs to be signed up for that, this is a good time to do that. So we do housing plans and work with folks to get into housing through community supports. We also have a rapid rehousing program, which is a short-term rental support for those who are literally homeless, not chronically homeless. And rapid rehousing can pay the rent and security deposit. It can also pay back due electric bills. Help them get into housing. We work with them on maintaining their credit, trying to, if they have a criminal record, we work with them to try to get things expunged, things that are, barriers that are going to keep them out of housing. We work with them to clean up their stuff to help them get into housing. We also provide wraparound service with rapid rehousing, stabilization. And we are also landlords for the Blue House on Oak Street and the Valley House in Redwood Valley. And I'm trying to remember how many units. The Blue House has 11 units, I think, and the Valley House has 9. And those referrals come through Anchor, formerly known as our QMC. So residents there have to be actively enrolled and engaging in mental health services. So an application for the Blue House or Valley House would go through Anchor. And I think that's all I have. Oh, I see that we have enhanced care management. We also have enhanced care management team at the Homeless Resource Center. And we try to enroll all of our shelter guests in enhanced care management to have a ECM worker, integrated care. And they team up with housing navigation. So folks enrolled in the ECM program will be working with an ECM care manager and with a housing navigator. We work with all of our shelter guests, anybody that's enrolled in partnership, we really try to get them enrolled in ECM and then connected with the housing navigator. But again, if folks are seeking enhanced care management and they're not part of the shelter, they can go in to B2 during service hours and request a referral for enhanced care management as well. And I think that's all I have.
Okay, thanks, Jen. I appreciate you giving us some updates on RCS's housing navigation program. Okay, and if you could stick around, that'd be good. We're doing great on time, so as long as I don't talk too much in the next presentation, we'll be good. Veronica, keep an eye on me. Okay, I'm gonna share my screen. No. Sorry. Here we go. Okay. Hi, everyone. I'm Lily Carabello, and I'm also here to talk about the Social Services Front Door for Families program. And my screen, okay. So what is Front Door for Families? So it's a project that was designed to provide housing problem-solving guidance specifically to families with children in Mendocino County who are experiencing homelessness or are at risk of homelessness. So for our program, they don't have to be literally homeless. They could also just be at risk of homelessness. So who's doing this project? It's through the Mendocino County Department of Social Services. We have Tammy Voris and Maria Noriega, who are here on this meeting with us, who are awesome housing guides and are meeting with dozens and dozens of families each week. Also Megan Van Sant, who's a program manager here, and Heather Chris, who's a program administrator, and we have Angela Kelly, who's an analyst, and also developed our awesome website, which I'll put a link in the chat in a moment, and Zoe Fernandez, who helps us with the project as well. But only 2 housing guides, so it's been a lot of work. The project's funded through 2 main sources. That's the Family Homelessness Challenge Grant, which was through the state of California. Its target population is families experiencing homelessness or at risk of homelessness. And when we say families, we're meaning families with children in the home. And also Bringing Families Home, which is through the California Department of Social Services and our Family and Children Services, CPS. And that target population is families involved with child welfare services. I actually forgot, I should add a little funding note here. We also have some funding through child welfare services that's to work with youth who are between the ages of 18 and 24, who are homeless or at risk of homelessness. So this project is for families, and what we're doing is the housing guides. Well, we have this website that was designed to be kind of like a self-service guide for anyone in Mendocino County, specifically for families with children in the home, that has lists of housing resources, and any family can go there, navigate through it, and find some resources for housing. And I'll show you the link to that in just a moment. Families can also go to the website to make an appointment with one of our housing guides. And what the guide does is helps the family review their options for housing, informally assesses their potential for various housing projects, helps fill out housing forms and applications, helps them apply for funding that may be available, and refers them to other housing resources. So we don't have any like magic necessarily. It's just that the magic of housing guides, like everyone who is giving presentations today, is we all need someone to help us through this really complicated system, and that's what the housing guides are there for. So does this project provide housing? No, we don't. We don't provide any actual housing. Front Door for Families does not own, manage, or provide any housing. What the housing guides have is lots of knowledge about what housing is available, whether it be low income, subsidized housing, applying for funding to get into housing, private housing. But we don't have any ourselves. This project does not create any new housing. The funding is not to build or buy any housing. The program does provide guidance and support, and some of the funding is helping fund the Flex Fund, which is provides like first month's rent and first month's rent or deposit or like a housing application fee, those kind of things. And the housing guide can help the family apply for that funding. Okay, so what we did in our first year, we launched this just a year ago. Our housing guides have met with over 250 households. We have helped them successfully, over about 100 families get housed if they are homeless, or stay housed, stabilized, if they were at risk of homelessness. And recently, so we met with 250 households, but recently our housing guides have been meeting with an average of 10 to 15 households a week. So it's a lot of families to be navigating through the system. The two resources that I wanted to point you guys to is our website, which is frontdoorforfamilies.org. That's frontdoorforfamilies.org. And there you can see the steps to housing. So should contact shelters, apply for subsidized housing, apply for rental assistance, contact rental agencies. Also, another resource for folks trying to navigate through these systems is to go to 211mendocino.org. And there is a quick link to housing and homeless services. And there you can find links to agencies that provide housing expense assistance, emergency housing, supportive services, affordable housing, and landlord and tenant assistance.
Lily,
That's it.
Lily,
Yeah.
our
Thank you,
website,
Tammy.
our,
Yes.
our website is frontdoormendocino.org.
Oh my gosh.
I put it in the chat already.
Thank you, Tammy. Tammy's absolutely right. Thank you, Veronica, for putting in the chat. I'll fix this slide before we send it out. It's frontdoormendocino.org. That's right. Okay. Okay. And that is all. Okay. Okay. So let's see. We do have time. We had less presenters this session than last session, and so we are done with plenty of time. I wanted to open it up for questions, right, Veronica? We can do that now?
Yes,
good?
but
Yeah.
before we dive
Okay.
into that really quick, we got a really interesting comment in the chat. Andrea Mendoza mentioned that they also offer community supports. Andrea, I don't know where you work.
I work at NCL Vision Family Resource Center.
Oh, beautiful. I didn't know you guys did that.
Yes, so we also work with the CalAIM ECM and community supports. We're specifically right now targeting families, and that's only because they're a little bit underserved due to there's already building bridges, anchor for individuals, and we want to focus more on families and children. And we do the community supports, which has that housing deposit once in a lifetime resource, but that is only if they do have Medi-Cal or partnership. And we could sign them up through here. We're contracted to sign people up for Medi-Cal. So that's the first step, making sure that they have Medi-Cal. And then we can turn in an application and see if they can get approved for a housing deposit. And part of that is also housing navigation. And what else is it? The housing stabilization with it.
So I work with families, looking for places, making sure that they're able to keep those places, contacting the landlords, having that communication with them. It's fairly new.
Yeah.
So we're still figuring a
Yeah.
lot of things out.
Thank you, Andrea. The Vision Family Resource Center, it's in Ukiah. It's at 102 Scott Street.
Correct.
And so there's several agencies in Mendocino County that are providing these CalAIM community supports and enhanced case management. And as Paul he put it in the chat, the link to the referral through Partnership Health Plan. And so if you submit a referral to Partnership Health Plan, they are spread out amongst all the community support providers. But you could also have a client contact one of these agencies directly for many of their other services, but also possibly to get into community supports and enhanced case management. And yeah, the Vision Family Resource Center is open to families now.
They're welcome to come in
Mhm.
and just set up an appointment with any of us and speak to us. It's almost better to get the referrals directly because when they get sent to partnership, they almost get lost or they'll get sent to a bigger agency from who knows where. So it's almost better to just get them here directly and we can submit that request
Yeah.
for them.
Senya.
Yeah, I just wanted to say that we're kind of doing an internal process since we haven't necessarily lifted our capacity reports to show that we're accepting through partnership health plan. And so the other thing that, we are trying to do internally is anybody that maybe would be a good fit for supportive meals. So I know we've been working with Cancer Resource Center, and they've provided us like an internal referral where we're working with them to try to get them supportive meals. And so there may be other qualifiers, like, if you're out of the hospital that might be eligible. I would recommend they go in first through the FRC so that way we can kind of evaluate them and do an internal so that they don't get lost through partnership.
Yeah, thanks, Senya. Thanks, guys. So are there any questions for any of our presenters today or any other resources you guys know about related to housing navigation that we should mention?
I just put in the chat wondering what, which of these services do or don't apply to people that are undocumented?
So for our Front Door for Families program, eligibility is not based upon immigration status. And for community supports and CalAIM, it's based upon Medi-Cal enrollment. So if they're enrolled in Partnership Medi-Cal, and many folks with different immigration statuses are able to enroll in Partnership, then they're eligible for the services.
All right, thank you.
I have a question.
Yeah.
My name's Travis Wright. I work for Northern Circle Indian Housing Authority, and I heard a lot of people say on here, kids, and they work with kids. But I've been recently going to Big Picture School, and they are needing help with their kids that are homeless. And I even have been there. I told them to call CPS to file a report. The school is getting told that they need to file the report where the mom is at. We have teachers taking home kids. I think there's a big problem going on. And we need to, I don't see anybody from the school district on here. It's a little concerning to me that we're not reaching out, but I hear a lot of us saying we work with kids.
So
Megan, are you going to
have
take this?
Blythe
I'm
Post.
gonna let Blythe do it.
Yeah. Okay, Blythe. Great. Thank you, Blythe.
Post here from the County Office of Education, and I oversee all 13 school districts for the services for foster and homeless.
Yes, so there is a process within MCOE, Mendocino County Office of Education, for schools to refer youth or
Identify.
kids that are homeless and identify them to the homeless students program that
So
Blythe
has
runs.
any of you guys reached out to the schools and invited them to this, or gave them the process of how to do this?
You know, I do think, Travis, you're bringing up a good point, and the young people, and I'm glad that's why the youth project is here, although they had to leave. The like 16 to 20-year-olds who are kind of making it work on their own is a really important population, and it's harder to serve because they're teenagers, you know.
Yes.
But Blythe, it does make me think that it might be worth it for us to connect with South Valley Big Picture,
I
because
don't think
Yeah.
this.
those
excuse
kids
me.
would be eligible through Front Door for Families, and we do
And
have
so
some.
our liaison at the high school and also South Valley work very closely with the youth project. Many of the referrals go through there, and any families that they are referring out to the community, they come through me, which ends up going to Front Door to Families or any of our community resources. But yeah, I mean, if we wanted to train our district liaisons with the same information, that would be helpful as well,
Mhm.
just so that they have
I
it.
agree.
But most of the time when they don't know, they call me and I direct them.
Yeah, I'm just concerned that the school district doesn't know overall as a whole. I understand that South Valley Big Picture is the starting point of this, but I have children and kids at all the schools. And it seems like there's a barrier here somewhere with stuff that's going on and a disconnect, because it should come to all together. We should all be together working to solve this and this, whatever, try to get a grip on it and that. But it's a little concerning to me that the school district doesn't know how or what to do.
Blythe, I'm wondering if maybe you and me and Lily should talk offline after this, because there might be some school specific, you know, connections we can make through you that I think could be worth it.
Thank you.
Yeah, and I think
Thank you,
that's an
Travis.
over assumption that, you know, our district liaisons work really hard to get families referred, and they do know where to go, and if they don't, they do reach out. So
Yeah, I
think there's some communication that could be cleared up for sure. So let's talk more later.
I just
Yeah.
think like maybe like a training for some of the schools or the school districts, that what is out there. You know, an invitation to this is extremely important. They're working with our youth. If we want to stop homelessness or end homelessness, we have to educate the people who are homeless right now with their parents, which are these youth. So I don't just work with the parents, I work with the family as a whole, because that child is experiencing homelessness now. And I don't want them to experience it again come 2024. If they do, they do. But we want to try to end the cycle.
Yeah.
And I just feel like this is a big disconnect of, we're all here.
Yeah.
But we're missing the other
More
part.
work can be done for sure.
Yeah.
Thank you, Travis. Let's see. Were there some other questions? I was
Andrea
looking
has
in the
her hand
chat.
up.
Okay.
Yeah, thank
Andrea,
you.
yeah.
So I did work as a community liaison at the high school. So I am aware that each school has a community liaison. And I've been having to teach my colleagues that there's a community liaison at every school, which, you know, they don't know about that right away. And then reaching out to the liaison of the children that I'm working with and letting them know, hey, this child is at risk of homelessness, and then realizing that they don't even know that. And so I was like, wow, like I need to be reaching out to these liaisons and working together with them, and also just letting like the social workers know that there's somebody at the school district that we need to work together with. So there definitely is a communication gap. I agree with Travis. But then I also do know that the liaisons are doing their very best. They do have a system in place. They do know if the families are doubled up, providing resources, providing supplies. So, but there does need to be more communication with
And you
the
said
school
that-
district and ourselves.
You said there's a liaison at every school?
In
Correct.
Ukiah,
So
I don't
there's
know
one,
about others.
there's one at South
Slide.
Valley or Big Picture.
yes,
Wow. And who is that?
That would be, hold on, is Brady on here? Hers just changed.
No,
I
it's
have,
Irma
was it Irma? Yeah, it's Irma. Thank you.
Irma.
Yes, there's a liaison at every site. There's 2 at Ukiah High School. There's 1 at Oak Manor. There's 1 at Grace Hudson. There's a liaison for Ukiah Unified at every single site. There's 1 at every single charter. And there is also a district liaison, which goes above and beyond at every single district in Mendocino County. We make and update that list every year. So we would be happy to get that out to providers if that's something like they're working with a family and they know that the child is enrolled. Oftentimes when I get families, they've moved into a hotel room or they're on a voucher and I'm assisting them to get their children enrolled. So we have to call the district and find out where the openings are for the grade levels, for special ed services, to coordinate all of that. But yes, there is a
do you think
liaison for
there's-
Ukiah Unified at every single site.
Do you think there's a way we could get that list? And do you think there's a way maybe that we as a team here together can go to the Unified and request them to? Because I bet you $1 million the Unified doesn't know us.
Travis, I think that that's a brilliant idea, and we can definitely talk about that through our COC work or other forums. But just, we have 11 minutes left in our presentation today, so just for the interest of time, let's all connect. You know, we definitely need to connect on this. There's no question about it.
And Travis, let's make sure that we have your contact information.
I know how to reach him directly.
Okay,
I
you
have
do. You
his
got it.
cell phone
Okay, good.
number. I got you.
Good. Okay.
Yep.
I'm just wondering, Andrea Mendoza, can you tell me the name of the agency you work for?
Yes, I work for North Coast Opportunity, and the program is Vision Family Resource Center. Yep.
Hey, I know that, let's see. I had a question, but I'm not sure if Paul is still on the line. I think it was Paul. There was Paul, you were mentioning about one of the services that you provide with housing navigation is helping them budget. And I've been really interested in this concept. And I was wondering, do you have a curriculum that you use to help guide folks through how to budget better, or some kind of materials, or what you're doing around that?
Yeah, so some of the groups that we do in the Wellness Center, are general life skills. So we do encourage folks to, go to all of those sessions, which would include, budgeting, saving, things of that nature. So we do that kind of on a group level, but
Is there a curriculum you're using during those classes?
Yeah.
Yeah. Okay.
Yeah.
I'm kind of interested. I'm going to follow up with you on that. I'm interested in it.
For sure. And then, aside from that, when a provider's working directly in the pre-housing, housing navigation, phase, we are trying to, get them to be, realistic about what we're looking for. So, and it's really helpful, I think, to the client to see, well, you've got this voucher, this is what you'd need to pay for rent over and above that, are you expecting to have internet? Most places pay these utilities and not those. And, just getting it out on paper so that when they hit the street or Tabitha comes to them with, I found this place, she can we don't, pre-screen a place for a client, not tell you about it because we don't think you can afford it. But she has a pretty good idea of, what their discussion can look like. Here's your budget and here's, all things added up with your income and, here's what the expenses would be. This is perfect for you, or, this might be a little tight, but I'm showing it to you anyway.
Yeah, I think it's really key in the housing navigation is helping them understand what they can afford and then to be able to remain housed, because now they have all these extra bills that they didn't have when they
Right.
were homeless, and to figure out how to budget for that is really key.
Yeah.
Okay, thank you. Are there other questions around for our presenters? Okay, so Veronica and I will work on posting the recording of this presentation on the COC website, and any materials that were received from the presenters we'll post there as well. And if you are on the list and receive the invite, or you send me info to put you on the list, then I'll also send out an email with the link to the recording and any materials, and an invite to the next session that I think we're going to focus on vouchers, right? Vouchers and subsidies. Is that right, Veronica?
And transitional housing, I
Or
believe.
transitional housing. We'll
Let
focus
me-
on one of those next.
I
So-
think it's a combination. Go ahead.
Maybe transitional housing. I think you're right. We're going to try to do transitional housing next.
Lily, I just want to, I can see
Yeah.
that from the chat, there's a strong interest in the list of the liaisons.
Mhm.
Okay, so sorry, I wanted to be clear that Ukiah Unified has community liaisons. I don't know about all the rest of the districts, but Blythe would be the best person to have a list of the community liaisons or their equivalents. So never mind. I see that Blythe's got that. So,
Okay.
yeah. I wanted to just manage expectations, but she's on top of it.
Okay. Awesome.
So funding and
yeah.
subsidies is our next topic.
Okay. So
So
we will be trying to work on gathering up some presenters. If you work for an agency that has a program that provides funding or subsidies related to housing, let us know, and we would love to have you present at the next session. Otherwise, Veronica, any last comments, thoughts?
I had one question about the front door for families.
Oh, okay. All right.
We had a question in the chat about asking, so to qualify, it's a child in the home age 0 to 18. And I said that is correct. But I then thought about, can you expand on that? Is it more than that?
I would say 0 to 24, because, and
wouldn't they have to be unaccompanied over 18?
Megan, no, right?
So we're kind of exposing
complicated.
we don't exactly know how to answer this question. So front door for families, yeah, the primary funding sources that we work with are for people with children 0 to 18. We do have some small amounts of both funding and authority to support kids that are 18 to 24. So, and yes, Veronica, that group would be unaccompanied, meaning they're not living with their parents.
Right.
Many of them are parents themselves, so then it gets kind of confusing.
Right.
They have a child, but they're not with their parents of that.
So if it's an unaccompanied youth, 18 to 24, they would also qualify. But if they're if they're in the same household as their adult parent and they're adults, they don't.
Correct.
Yes.
So if it was a household that had a mom and a 22-year-old and no other children present, that would not be a household we would typically target.
Okay. Okay, I think that's it. That's all.
Lily,
yeah.
I noticed
Oh,
there
sorry.
was a question. Somebody was asking to give more information about the CDC voucher that's closing on the 18th. Can I just give a little bit information on that?
Yeah, because it's closing
It's called
soon.
the mainstream voucher. You do not have to be experiencing homelessness to qualify. You do need to be between the ages of 18 to 62 and have a disability. You don't have to be on disability or be receiving disability, but have to have a disability of some sort. And then just you can either get the pre-application off of the CDC website or just have them go into CDC during business hours.
And by CDC, we mean the Community Development Corporation. Corporation, is that right? Yeah.
Community Development Commission.
Commission, thank you. I was like, what was it? Yeah. So,
it's our local housing authority. It's on 1076 North State Street. Thank you.
Sorry,
Jane.
what was that called again?
The Community Development Commission.
Oh, but what service were you talking about?
It's
It's-
for the housing voucher, the mainstream housing voucher.
Mainstream is a misnomer, though. It's like not mainstream. It's those
Right,
with
right.
disabilities.
Tenant-based,
Yeah.
it's also called the tenant-based housing voucher. And the list will close on the 18th, so.
It's actually the 19th. I went to the website.
Oh, okay.
Oh,
And
Oh.
so I put some information in the chat earlier. It's farther up though.
But if you type into Google, like Mendocino County CDC,
It'll
I
pop
think
up.
it should come up and you'll
It's
be able.
cdchousing.org.
Yeah.
It's super,
Okay, there
it's
you
even
go.
easier to remember than Google.
There you go.
cdchousing.org. And we are inviting CDC to present on their voucher programs at our next presentation.
Absolutely. Yeah.
unfortunately, that list will be closed though, by the time they
Right.
come in.
Yes, yes. But those who want to know more about what CDC
Right.
offers.
CDC has some other
will-
voucher
we have more
programs.
information
Yeah.
coming.
I have a really quick question before we close out. I'm just wondering from these webinar series, which have been awesome, fantastic, great job everyone and all the presenters. Is there like a follow-up resource list, just like with contact information and maybe the presenters and like a short recap of their organization, or is there any kind of like forms or anything coming from these webinars that could assist us in recalling all the great
I would say
organizations?
definitely check out the COC website, because that and I think it's under resources, right, Veronica? If you go to the Mendocino County's COC website, there's a tab for resources, and that's where you can find any kind of information on this or the last session and the recording of the webinar. You could also find all of these agencies listed in 2-in-1 Mendocino if you're looking for their contact information, or Google them.
Okay, thank you.
Okay, we're at time. Thanks, everyone. Appreciate you all being here. And we'll keep going with these since they seem to be useful. Okay, thanks. Have a great day.
Thank you.